Good afternoon. This is Aida Otaola. I am the Digital Marketing Manager in Virtualware. Welcome everybody, and thank you all for joining us today in a new webinar titled How to Engage Healthcare Professionals in Times of COVID. It's part of a webinar series we are launching during these difficult times. This is our ninth session focused on helping you to become the champion in digital transformation. I hope you will enjoy these 30-minute sessions. The Q&A section is open. You can send us any questions you may have that I will be checking, and I will try to answer at the end if we have enough time. I am happy to introduce you my colleague Julio Álvarez, who runs our health business unit, and he has been working in this sector for more than 10 years. He loves facing new challenges and projects in which interactive and immersive technologies truly add value. Enjoy the session, and okay, go ahead, Julio.
Thank you very much, Aida, and good evening, everyone. Good evening in Europe, or good morning in US if you are joining us from the other side of the sea. Thank you very much for finding time to attend this webinar today, which for us is a pleasure and is an opportunity to share with you what we are delivering to the healthcare sector during the last years. Hopefully, we have succeeded with the selection of profiles that we invited to this webinar. So if you are working in a pharmaceutical company, both in a medical or marketing department, and you are looking for new engaging ways to motivate your customers, you are in the right place. On the other side, if you are a scientific consulting company for the pharmaceutical industry and you are looking for new alternatives to offer for face-to-face event, you are also in the right place today. By the way, I just noticed or realized that I missed with the healthcare word in the title of my presentation. I don't know why, I just removed it. I'm sorry for this. Of course, we are talking about engaging healthcare professionals with technological tools. So let's move to the next slide, and let me introduce you briefly our company. So we are Virtualware. Virtualware is a software company, it's a technological company. And since 2004, when this company has been launched, we have been developing bespoke solution or customized solution for different sectors. These sectors are education, heritage, tourism, industry, but we are a global company. So we have offices in Madrid, we have offices in Bilbao, we have offices in London, also in Mexico. We just opened commercial operations in Toronto, Canada, a couple of years ago to start working with the US market. And yes, we have 16 years experience in the field of technologies. Which technologies? We are working mainly on immersive and interactive technologies. And this is a company that is made up of 60 talented professionals. All of them are passionate about these technologies. And in 2010, we opened the healthcare business unit to offer the technology, but apply it to the healthcare sectors. We have had the opportunity to work with different customers, mainly with pharmaceutical industry, but also with scientific societies, patient associations, hospitals, and non-profit organizations as well. But let's move to the topic that brings us today, which is the situation and how to fill the gap on the lack of technological solutions for continue engaging your customers in scientific meetings where there is no possibility to meet, to make face-to-face meetings. As you may know, and as you have suffered yourself, the situation due to the COVID-19 has made that many events have been cancelled or postponed during the last months. And we are not talking only about regional level meetings, but also national or international meetings, or even big events such as the Tokyo Olympic Games that has been also cancelled, or the Tony Awards that have been also cancelled too. So hundreds of events have been cancelled or postponed. In fact, many of them have been cancelled little more than the day before, as you might have suffered as well. What happens with scientific meetings? Scientific meeting is the same. We are in the same situation. From our experience, and according to what we have been able to see during the last months, the percentage of scientific meetings that has been cancelled worldwide is very, very high. We are close to 100%, depending on the country. And if we are talking about international conference or meetings, all of them have been cancelled. But these are the bad news. But let's see a positive point here. After several months of confinement, we have been suffering. Teleconferences, webinars, virtual meetings. It seems that we have been more comfortable with this kind of meetings during this time, which is not bad. It's good, because seems that this situation is bringing a definite change on mentality that probably will stay, and this is why we need to take an initiative and try to solve and trying to give more opportunities to the online or non-presential meetings and conferences. But on the other side, there is still the need for the pharmaceutical industry and the healthcare-related companies that need to keep contact with healthcare professionals in order to continue offering good educational and training initiatives, of course. But as we are not able to join and to meet together, there are many companies that are investing in adapting their technologies to the new situation in order to fill the gap that is currently in place, and in order to solve the need that is currently growing. So the reason why we invited you here today is because we want to share with you exactly this, the adaptation of one tool we have here, mainly initially created for presential meetings to non-presential meetings. This tool is VirtualClinic. VirtualClinic is a very innovative, interactive training simulator that is based on the resolution of clinical cases. We are now just launching version 2.0. This product has been launched in 2014, and as I commented before, the main target of this product was to help on the dynamization of presential meetings with many people. But now we have to move to a different situation, and this product, this new version, has many improvements. The main one is the possibility to have the online support for non-presential meetings. What else can we tell about VirtualClinic? VirtualClinic is highly interactive. It's interactive because it's user-friendly. It uses a very user-friendly interface, and it has some gamified features such as collaborative or competitive collaboration, or team participation, or individual participation, and many other gaming techniques that we will see later. Additionally, we have improved a lot the user experience, and now it's very easy to use with a web browser. There is no need to make any kind of installation, and this is why it's very, very convenient. As we will see later, VirtualClinic is also a very attractive tool to help analyze clinical decisions, due to the fact that this simulator stores all the data that is included, is entered by the professionals. So, what else can we tell about the virtual clinic? It adheres to the highest scientific standards, because all the clinical cases that are included in the platform are developed together with the support and advice of experts. Of course, they are following the clinical guidelines, validated protocols, and scientific evidence, but we don't have to forget that all the clinical cases need to be addressing a strategic need, probably from the marketing strategy of the pharmaceutical company. So this is a good point. It is very adaptable. So if you are here and you are a scientific consulting company providing services to the pharmaceutical industry, you can offer this product to your customers and count on us to help you with this. But if you are a pharma professional, you are working on the medical or marketing department in the pharmaceutical industry or training department, and you need a full project, we can also give you the opportunity, because we have our partner that has been developing this platform with us since 2014. Adelphi is a global network. It's a global company that has offices across US, Europe, and Asia, and they can provide the scientific advice and support in order to define the strategic objectives for the clinical cases, and also to coordinate experts and to build the clinical cases so that we can give you a full project delivered to you. What else can we tell about the clinical cases that can be hosted into the platform? Any patient profile can be included. As you can see here, there is a screenshot of the application that shows that the structure of VirtualClinic is very easy to follow. So any clinical case can fit in this structure. So the patient is coming with a reason for the visit, then we go to the clinical history of the patient, and then we go to the anamnesis. We can make the physical exploration, ask for complementary tests, summary report, then diagnosis and treatment. So the thing that we have added in the new version 2.0, is that now we are able to manage the patient throughout the course of the disease. This means that we are not only limited to start the clinical case, make a diagnosis and treatment and finish, but now we can also have the opportunity to treat the patient during a longer period of time. For instance, when the patient is coming back due to a recent relapse that he has or she has, or because he or she is coming for a routine follow-up visit, or just because they have adverse reactions that need to be treated in this situation. Some of the clinical cases are already diagnosed, and the only exercise that we need to do with VirtualClinic is to help the patient through the course of the disease, trying to help them to lower the adverse events and everything. What else can we say? Yeah, it's a very flexible tool. This means that we have the possibility to include different media formats to showcase the outcomes of different tests and analysis. As you can see here, we have a computer axial tomography, but we can also make some blood tests and other analytical tests, as you can see here. Why not we have the possibility to include some imaging, such as magnetic resonance, ultrasound imaging like this one, or even a document like this one, which is it's like a photograph, is an spirometry from pulmonary disease. Also an electrocardiogram, whatever has an output file, an output image, or a video, we can include here as a additional testing. In Virtualware, we give very important, big importance to the user experience, and this is why in the new version we have made the possibility to access this product from a regular web browser. And the positive point is that there is no need to install anything. So for physicians or for the users, it's very easy to go to access to click on a link and then access VirtualClinic and just put the access code provided, and that's all. You are in. Additionally, VirtualClinic works in both iOS and Android devices. Very important to say that the user experience is not good by using smartphones, so we need to use a tablet. In fact, the program, the application is not available on this market and this market for a smartphone, just for tablets. And also, in order to improve the user experience, we have added some game mechanics, such as this countdown or ranking or distracting elements, as you will be able to see later in the demo. I am going to showcase you and other game mechanics such as a score. These game mechanics are probably thinked for presential meetings, but can also be used in online or non-presential meetings. Some use cases that we have been able to work during the last years, and of course the one that brings us today is the possibility to use as a continuous medical education online program available via web browser. But in the past, for presential meetings, we have worked a lot on national and regional meetings for between 20 to 200 users at the same time in the same room, all with an iPad on their hands. Big symposiums, also small meetings such as advisory boards, and last but not least, the market research of specific situations in the market is also one reason why customers are asking us to provide this tool, because every decision that is taken inside the simulator in order to solve the clinical cases, but all the group of professionals is stored, and you can have the possibility to analyze everything and to create interesting reports that you can share and take decisions later for strategies. There is also many companies that are using this for internal education. So let's try to show you a specific use case example for a post-confinement online educational activity, which is this one. So let's assume that we have been working 2 months before. This is a timeline, day 1, day 30. This is we have been working during 2 months for the creation, definition, and uploading of a couple of clinical cases to the platform. So everything is ready. This period has been passed. Now the format is, we start on day 1. We open the waiting room, so the patients are ready to be attended by the, let's say, 100 physicians that are accessing via web browser the platform. The playing time would be opened during 15 days, as you can see here. But on the meantime, we have the possibility to make a follow-up contact or call, could be made by the Salesforce or by the scientific provider. And this would be also another opportunity to continue maintaining contact with the customer, which is something that we are lacking during these times, because visits, hospital visits are not allowed neither. Once the 15 days period of solving clinical cases is finished, then we close the waiting room, all the data is stored, and then we take off the data and we create the report for the next event. We made a call to event for an invitation to a follow-up event, which is going to be is going to take place on the day 13, for instance. And in this event, you will invite all the participants to join an online meeting and webinar, and you will have a key opinion leader to share all the results that have been obtained from this 15 days phase of solving clinical cases, which is probably the most interesting part when you share with your customers the results and you create the controversy and the discussions and the question and answers and everything. So this could be a 1 month period of an interesting activity where you can have your customers engage with you and with the science. A very important part of VirtualClinic is the data that is stored inside in order to get the KPIs that are crucial for commercial or marketing activities. So once the period is finished, the system stores all the clicks that the professionals have been doing in the training session. So if you want to have an analysis about diagnostic choices of the physicians, you have the possibility, or treatment, or if you need to, for example, to know which professionals are demanding a specific test or not, then you will have the possibility to share these results with all the people in the meeting. So in terms of analysis, so market research is a very interesting point, reason why you could be interested in having VirtualClinic, not only for the interactive and funny way of solving clinical cases, but also for the information. You can give feedback to the doctor on its decisions, on benchmarking or simulated work data. The following tool, which is called the Presenter, is an add-on that we created for VirtualClinic, mainly for presential meetings, but it can also be used in non-presential meetings. So this tool is managed by the moderator or the key opinion leader that is moderating the session. And with this tool, we have the possibility to open and close the waiting room in real time. So if you want to create a 1 day, for instance, a 4 hours or 2 hours training period, you can open the waiting room and close it at your convenience. You can show a countdown. Here, I'm going to show you. You can show a countdown, and you can show the rankings of the people that is solving the clinical case, because every clinical case has a score behind that has been created following the guidelines and the science. And probably the most important and most powerful part of the presenter is the possibility to show live the results. So in this case, there is no need to export the data and create a report, but the presenter gives you the possibility to share with all the users the results in the same time, just after closing the waiting room. There's an example of ranking showing in the meeting. These screens can be also shared via webinar, so this is another possibility. In 2018, VirtualClinic has been awarded with ASPID Gold award, probably the most prestigious award given to a commercial initiative in Spain and Latin America, which is for that has been a very interesting success. And since a picture is worth 1,000 words, I'm going to share with you a video of the usage of VirtualClinic. Hopefully you will see that the video worth more than 10,000 words. let's see. I'm going to continue commenting So once the user opens the application, in this case, we are simulating someone that is using an iPad. They have to input to add the code that has been generated for them, and then they are entering the waiting room. In this case, we have 2 patients here. These 2 patients are in this demo are for pulmonary related pathology. So we have here Pilar. If we click on Pilar or we click on Tomás, we can see the patient or we can close the patient. So we are going to click on Pilar. And as you can see here, this is the reason of visit. It's a short description of why Pilar is coming here today and is waiting us for being attended. So if I click on see the patient, I'm gonna see this clinical case of Pilar. Accept, and then so the first point is that we have the clinical history. So in the clinical history, you can see anything that is relevant to try to solve these clinical cases. Different treatments that he has been on, symptoms, and clinical history. Then we will move into. Then we are jumping into the anamnesis. Anamnesis works like a chat. So we can ask Pilar about specific things, and she's going to give us an answer on the immediately. As you can see here, do you still smoke? Yes, I still smoke. Remember that these are pulmonary related diseases. Asking about what happened about 2 years ago. Okay, so during the anamnesis, I also have the possibility to pass some scales and questionnaires. These are on a scale very typical for COPD, adherence of inhalers, in this case. Then we move into physical exploration, and then we can just make some cardiac auscultation, pulmonary auscultation, respiratory frequency, oxygen saturation baseline. Then we can add some complementary tests, and in this case, we can make a blood analysis, liver and kidney function as well. As you can see here, the results are similar than the ones that are given by official hospitals. Other tests related to exactly to these diseases, so oximetry, spirometry. But we can also add some imaging tests to ask for imaging tests, respiratory polygraphy. Let's move into the imaging tests. I forgot to say that as the resolution of clinical cases are scored, it's important not to click on every option that you find here, because there are some options that can add points, or there are some options that gives no points, and there are also options that you click that can rest score. So this is very important to use the minimal or the exact resources you need, and not to ask for more resources or tests. So if we move to the imaging tests, we have the radiography, for instance, but we can also ask a CAT, and we can see here the CAT. Then we jump into the summary report. The summary report includes everything since the reason for visit, the clinical history, and everything that has been asked, tested, or explored during the resolution of this clinical case. And we can hear here, we probably have all the information that we need to make the diagnosis of Pilar in this case. So we click on diagnosis and we say, well, it's a COPD with a degree of obstruction moderate, gold category B, for instance. And you can see that there is not only there is the possibility to give more information about the diagnosis. And then this one. So I talked to you before about the possibility to destructive game mechanics, and in this case, if the users are playing, let's say, and they have a countdown and they have a limited time for answering the clinical case, they have two options. They can answer this call and give answers to this doctor that is asking you for an interconsultation, or you can hang up the conversation, but you won't win the score for you and for your team. So let's in this case, I'm gonna hang up. So this is Dr. Pedraza. He's asking me about a patient that he has 57 years old with this situation and these results, and he is asking me what would I do? I would suggest him to refer to a neurologist, and then I'm gonna continue with recording the diagnosis in the phase that we were before. Now the treatment, as the COPD, as far as I remember, it's treated with LAMA-LABA's combinations. So I would select this one and click on next. And then we have also the possibility to recommend non-drug treatments such as improve inhalatory technique, low salt diet, or whatever. Then next, are you sure you want to record? Then I have the score. This is interesting in terms of gamification, and now it's finished. Pilar is gone. Now I have the possibility to treat Tomas and continue with the solution of clinical cases. This is, I want to say that VirtualClinic, the version that you are seeing here, it's available in both iOS and Android markets, Google Play and Apple Store, and you can download it for free. And there is a demo mode which includes exactly these two patients here that I'm just sharing with you. So it's important to say that the only way to access to get this application is via tablet, not smartphone. It's not working on the smartphones, and you feel free to download and to test it and to try it. And of course, if you have any question and if you need something from our side, that we have a lot of experience helping mainly pharmaceutical companies, but also other professionals in the universities, for instance, trying to help them on how to put this solution ready for them and to succeed with this initiative. So thank you very much. These are my contact details. Not sure if there is any questions. I would be happy to answer any question that you might have, and happy to answer.
Thank you, Julio. We are looking forward to releasing the 2.0 version. Well, I'm checking the Q&A section, and we have a few questions. The first one, is it available in different languages? How it works?
This is a good question. Yeah, in fact, it's available in the languages that you want to create the clinical cases, but if you have the possibility, for instance, to have the same project to deliver worldwide, let's say, we can create the same clinical cases with different languages for accessing from different countries. So this is something that is possible, and it's already in the application. The application is ready for this.
Okay, the second one is it possible to access to the same course from different devices?
Yeah. In fact, let's imagine a situation where you need to have some clinicians that are accessing via their web browsers, but you also have another group of physicians that have an iPad, and some of them have an Android device. In the same project, solving the same clinical cases, we can get all these platforms working together in the same project without any problem. So many multi-platform, multi-language, no problem.
Great. And the last one, have you used VirtualClinic with COVID-19 clinical cases?
No, we have been asked. We have been asked a couple of weeks ago about the possibility to use the VirtualClinic with, but we haven't finished this project with this opportunity. Hopefully, yes, in the coming future. Let's see. Not yet.
Okay. Well, there is no more questions. So thank you all for attending this webinar. Thank you, Julio, for this great 30 minutes. Don't hesitate to contact us if you have any other question you may have in the future, and thank you again.